I guess there's no such thing as a typical week, but what I'm responsible for on behalf of the organisation is ensuring that all the staff are trained around equality and diversity. I design and deliver leadership programmes to managers and various other staff. There's a number of equality forum groups that I get involved in. So there's a wide range of different people who clearly aren't corporate or who work for the NHS that I need to engage. We need to get out there and understand what is it that the patient's needs are, what do they require, and working with them, not leading them. I guess there's no day that's the same. That's what I like. No day's the same. If it was a Groundhog Day, I'd be rather bored. And I think the main thing is I am a people person, so I like meeting different people. They have different challenges, different needs, and that challenges me as well. And I'm learning as well. I'm a lifelong learner, so that's really important for me. I was involved in a leadership programme here called Passport to Management. So we recognise that there's a number of staff who are promoted who probably all haven't got the requisite skills that they need. So there's a number of specialist trainers who are involved in the programme, and I was asked to be involved around equality and diversity, which is a broad brushstroke, but I covered unconscious bias because we now have that included in CQC as part of its inspection. There's something around bullying and harassment. We need to know about that clearly with the mid-staffs and all the other issues that occurred. We need to now look at what lessons can we learn as an organisation, how to deal with that, developing diversity champions, making sure we have those across the trust and they're all skilled up equally, and looking at difficult conversations in terms of equality and diversity, the canteen culture, which is no longer applicable. So I was asked to design something there, and I roll that out every quarter. So I did a master's over at Bradford with Professor Udi Archibong. That was a real turning point for me because I learnt a lot of things around good business sense, why it makes good business sense, integrating it, developing a strategy, leadership, strengthening up on my presentation skills, a whole range of things which I could bring back to the organisation and share with my colleagues as well. One of the things that we had to major in for our thesis, well, we had to decide what we was going to do, and I decided as a lifelong learner that there was a knowledge gap for me around the transgender agenda, and I also recognised developing the diversity champions here that equally there was a little bit of a knowledge gap there, so together I thought we could learn something. So I developed a policy or a guidance, and I did that through interviewing various people who were going through transition as part of my thesis, and that was interesting, and also interviewing various staff here. So it's about transgender patients accessing primary and secondary care. So looking at the challenges, where they are now, what are the challenges, what can we do better? And also leading on from that, I brought somebody in from the transgender community to actually give a presentation. So I sort of mentored and nurtured that person. It's important them never being in a corporate environment to make sure that they're in a safe environment. So they presented sort of a patient pathway, if you like, to the diversity champions, and evaluating that there was lots of learning, and together we developed a transgender policy, which was one of the first ones, and we've had lots of requests for that. RCN, Unison have asked to look at the policy, so we're quite proud of the guidance document that we've done. Still got a long way to go, but it was a starting point, and again, as I said before, I've learnt a hell of a lot, and I still now incorporate that in staff training around the transgender agenda, their experiences and national research from Stonewall, what Stonewall says about health inequalities, because that's really important. It's not just about the Equality Act. I'm getting onto my soapbox now, but it's all very important. So that was very key for me. And again, going back to the Masters, and if it wasn't for Andrea supporting and funding me, I won't be in a position to explore that wider. It was a new project I was invited to work on, and that was around networking, being inclusive. How do people network? Because what I've realised, working for the NHS, you need to be able to network, develop different types of communication skills. Clearly the corporate communication skills I have here aren't going to be required working with the local disability forum because they have different communication needs. I learnt a lot there in terms of how somebody entrusted me to do a big project which was region-wide, which potentially had a big impact, and it could have all gone a bit pear-shaped, as they say in Bolton. And I thought that was fantastic. It was a good feeling to do that, that she trusted me And I thought that was really important. And when she came along, it was like my baby, which I've nurtured. And it was sort of, you know, it all came alive and it all went well. I mean, it was quite stressful, but then again, all projects are. And it pushed me, it challenged me, but the outcomes were based on the evaluations that people enjoyed that. Again, it was an opportunity to meet different people, work with a wider range of people with different skill sets. And what I particularly liked about that was working region-wide, where all the things I've said previously is working locally around Barnsley. The opportunity I had with Andrea was taking me region-wide, and that's what I really, really enjoyed. I think the main thing that I want to say is, I guess in my role, whatever I do, it's about patient experience. It's about improving better health outcomes. And as a black woman, it's not just about me improving patient experience from a black perspective, but there's a key word which I learned on my masters, which I keep banging on about intersectionality, which basically means that everybody has a different experience. So as a black woman, I may have a different disability, I may have a sexual orientation, a different faith, and it's about making sure that we're inclusive. So intersectionality is really key, and if I do that about my work, it's about improving patient experience and ensuring we get a better health outcome for everybody.